Grant Garcia here, one of the cartilage and knee surgeons at Orthopedic Specialists of Seattle. This is going to be an interesting video testimonial. This patient is younger, 40, 44-ish. She came in with lateral-sided pain and this thing we call instability. Now, it's not instability like you hear from an ACL, but these patients with lack of lateral meniscus, they complain about this instability. If you do a lot of these cases, you'll see that you can actually correct this with the meniscus transplant. So she was missing her meniscus, she had cartilage damage, but she also was starting to have some slight changes of her tibial plateau, which in some cases is kind of one of those on-the-fence situations. She's 44, straight knee, so no other real treatment we can use for her. She's way too young for knee replacement. And so we decided to go for it and do a meniscus transplant. So we did a meniscus transplant, cartilage transplant. She's over a year out. Again, really well. She's incredibly happy. Her pain has improved. And she really persevered through this, and I hope you enjoyed the testimonial.
I got hurt roughly, I guess, 4 years ago. It went undiagnosed, and so I continued to do like hiking and dancing, and it kept getting worse and worse, such that I was having instability in my knee, and that was what was bothering the most. So after I got an outside organization to finally give me an MRI, I came to see Dr. Garcia to see what options might be available. He looked at my knee. Because of my age, I wasn't a good candidate for knee replacement surgery, and so he said that I wasn't quite sure that I'd be a good candidate for a meniscus transplant and an osteochondral allograft transplant as well, but that it would really be my only option at this point if I wanted to move forward and be able to do my activities without pain and without causing pain in other parts of my body. So the pain was sort of an aching, so I wouldn't feel it necessarily immediately when I was doing activities, but afterwards I would feel sort of an aching in my knee. It was also getting less flexible, so the range of motion, I wasn't able to bend it as much as I am again now. And then also just sort of it was affecting other aspects of my knee, so I think like the IT band on the outside of my knee and also my hips, because the knee placement wasn't correct. So the recovery has gone really smoothly. It is a long recovery, but I was prepared for that. I was warned about that up front. So I've been going back to activities little by little. I might be a little bit more on the conservative side, but I have returned to all of my activities at this point. I just wanted to focus a little bit more on muscle strength. So yeah, I'm back to all of my activities at this point. So it definitely exceeded my expectations. This was definitely, as I said, this was a little bit of a gray area of whether or not this would work, so it was a little bit of a risk to even move forward, but in the end, since the next option was at least 10 years away, I thought that it was worth going for, and it's definitely exceeded all my expectations. My knee is much more stable. I feel like I can do my activities actually even better than I could before. I guess maybe I had forgotten a little bit about that, probably because it had been so long, and I would do it again without question.
And then, would you recommend this to a person if they had the same issue?
If somebody had the same issue with me, I definitely would recommend it, especially if they wanted to stay active and they were in the same sort of situation that I was, that there's no other good option for a long period of time.